Hello, the following is my interview with Dr. Jennifer Mushtaler, who is an OBGYN. I hope that anybody out there who wants to become a doctor may find this interview helpful. And thank you for watching. Okay, well, could you tell me what you do and what your current job is?
I am a physician and I'm in the specialty of obstetrics and gynecology, so women's reproductive health care.
So, what are the responsibilities in your current job? And if it helps, you could describe a day in your life.
Cool. A day in my life, it's part of the reason when I went through med school that I really liked OBGYN. It's not the main reason, I can always get into that with you, but part of the reason I like it is because my days are never the same. There's not a typical day. There's always something different happening. As an obstetrician gynecologist, my day can be anything from seeing patients in the medical office, doing exams, helping to diagnose a problem or treat it. I could be in the operating room during surgery. I operate and I do surgery, or I could be over in the labor and delivery unit caring for a mother in labor and delivering babies. As anybody who has dealt with children knows, their schedules and timing can be unpredictable and babies can come at any time. So that means that my days and nights are never the same.
So, would you say that it can be stressful sometimes?
Yes. I love what I do. And I was very drawn into the particular specialty of obstetrics and gynecology. I like to explain to patients when they talk about having a baby and what they envision the delivery will be like and what the experience will be like, that my job is to watch the process unfold and be ahead of it in terms of understanding if and when a baby or a mother's life is in danger. So when I actually have to intervene and act, that usually means because something's not going the way it's supposed to. And at that given moment, you have two lives at stake that you're responsible for. So there are times and there are situations where it can be very stressful. And certainly in the operating room, when you have the care of a patient who's under anesthesia and undergoing surgery, they're directly under the care of your hands and what you're responsible for. So you are managing a high level of stress.
So, what skills or personality traits do you think a person needs to succeed in your job?
My chairman, he was the head of the residency program. And I think he was very good chairman. Ralph Anderson, if he's ever watching this. I respect him tremendously. And one of the things that he said he looked for when he would select residents to come into his training program was controlled confidence. So you wanted to find somebody who had strength of character and enough confidence to get in when they need to and not be timid and hesitant, but also enough control and awareness to know when to call for help, when to stop, where the boundaries are. Controlled confidence.
So, after high school, where did you go for further education and why?
I'm a Longhorn. I attended the University of Texas in Austin. Hook 'em! And my journey was a little different than a lot of people's in medicine. I did my undergraduate training, my undergraduate degree in electrical engineering. So my dad was an engineer and worked for NASA, and he worked on ground control systems for the Hubble telescope, for the space shuttle, for the robotic arm that launches things into space and stuff like that. And I grew up in that community. I grew up with astronauts' kids, and everybody somehow was connected to the space program. So initially, and I love math and science, I still do. And so I initially went into engineering, and actually was very fortunate to go to the school on scholarship.
So, Were you like, did you know that you were going to be a doctor then, or were you
No,
like how was it?
not at all. I got very involved in engineering, and I really did enjoy my education. I think, and this has come up a number of times for me recently as I've evaluated even where my career is and how my job has changed and what's changing for me and what I'm going to be doing, as I continue in my job role. But there was so much I didn't know when I was coming out of high school about what you could do and what you could be. So what I knew of engineering was what my dad did.
Yeah.
And when I went to school for engineering, most of in electrical engineering, most of us did what we call cooperative education, which was a program to go and work for a company a bit and have an internship with them as part of your education. And all of that was in engineering. I was in hardware. So a lot of my friends worked on circuits and motherboards and things like that. And I actually found that for me, I didn't feel energized and excited about it the way some of my classmates did. And so I thought that that was all I could choose from. I didn't realize how many different doors were open and how many different pathways your career could go from a degree in engineering. And I think that's true of a lot of different things, whether you were to choose to go into science or humanities or mathematics or language or anything. There are so many career opportunities, no matter what you're in, that you may only know a small piece of it, and you may think, oh gosh, this isn't right for me. So I knew I liked math and science. I really enjoyed that, but working behind circuits and computer boards, I really felt like I was missing the human stuff. I'm a people person, in case you can't tell. And so I couldn't see myself doing that because I couldn't see a way to put that all together and have a career path that I'd be happy with. I did have a lot of my high school classmates and some of my college mates were doing pre-med and thought, knew all along they were going to be doctors, and I wasn't one of those. But I thought, as I tried to figure out, well, what am I going to do with this engineering? I'm not liking what I'm doing. I thought, well, maybe I'll do biomedical engineering. And so I started taking some of my junior and senior level courses in the biomedical department. I got to work in one of the labs and that kind of stuff. And when I was working in one of the labs, the PhD doctoral student who was in that lab that I was kind of working for also had his medical degree. Some people actually get an MD and a PhD. Let me tell you, he was smart. And I would ask him a lot about, he'd already done his medical school part. Now he's doing his PhD research part. And I would always ask him about med school and what it was like and that kind of stuff. And he didn't really like the people part. He liked the research part and the science part. That was really what excited him. And so when he would talk about it, he would be very like, oh, it was like we did this and he didn't like it. And he did, it wasn't for him. But as he would tell me stories about his experience, I was like, that sounds so neat. You got to do that? That sounds so cool. And so I began to think about, well, I wonder what it would be like to be in medicine. I didn't have anybody in my family who was a doctor or anything like that. And some of my friends were doing it. So I ended up taking some of my pre-med requirements in my biomedical engineering area. And I thought, well, I'll probably go on and get my master's degree in biomedical engineering and maybe do research in that area or work for a company that develops things like that. And kind of on a whim, I decided I'd take the MCAT, which is the entrance exam for medical school. And my friend, who always knew she was going to be a doctor, she had prepped for it. She used these prep books and everything like that. She gave me her prep books. Like, okay. So I used her prep books and I studied for it. And I surprised myself and did really, really well on the MCAT. And so I thought, well, I like the biology stuff I'm doing. I like people. I like science. I did well on the MCAT. I'm going to go to medical school. And so that's how I ended up in that direction.
So what drew you specifically to gynecology?
Good question. I was on my pediatrics rotation. I actually thought when I went into medical school, I thought, well, maybe I'll be a family practice doc and do kind of the general care medicine and take care of families and live in a small town and be that, Dr. Quinn medicine woman or something like that. And then I thought, well, maybe I'll do pediatrics. I really care for children and that kind of thing. And when I was on my pediatrics rotation, I went with the resident to delivery, a cesarean section. They were delivering the baby by a cesarean section for surgery. And I got to stand in the back of the room. And this is the first time I've ever seen a baby born in my entire life. And it's surgical. And they said, I was curious. And the attending who was managing the case said, well, you can come over and look, but don't touch anything that's sterile. And, stand here and don't touch anything. Okay. And when they delivered that baby, I got to tell you, it was for me, it was the most amazing thing I'd ever seen. It was the most amazing and beautiful thing I had ever seen. And that was it. That was it. OBGYN is kind of a neat specialty as far as medicine goes, because I am blessed to have relationships with my patients through their lifetime. So patients can begin care with an OBGYN in their teenage years. I'll see a lot of young girls for period complaints or issues or problems or things like that. And I'll be their doctor through their whole life. I get to watch them grow up. I get to watch them get married. They will come in my office and cry about a job issue or a boy issue or whatever it is. And I get to take them through their family and all of that. And so I get the longevity of the relationship, but I also get to do a lot of the things with my hands that I like and drew me into engineering. I get to operate. I use my hands and the technical skills and the scientific technologies to be able to cure. So, and it goes back to your question earlier, none of my days are the same. It is not boring. It is never boring. It might be too busy, but it's never boring.
Good. So do you find that in your day-to-day life, you still use your knowledge in electrical engineering in your job?
Indirectly, yes. When you start in an engineering degree, and it doesn't matter whether you're going to be a chemi or an ME or an aerospace engineer, you're going to take certain calculus classes, you're going to take basic physics. I think for electrical, we weren't required to take chemistry, and that may be the same for mechanical or computer engineering. I had to go back and do that for my biomedical, but you're going to get your physics, and there are just certain basic things across the first couple of years that go across all of them, and they apply. And absolutely I think as far as my upper class course, circuit design theory and electromagnetic wave theory and solid state and those things, no, I'm not using those now. But the thought process, how you learn to think through a series of steps and problem solve, that has everyday application in medicine.
So, okay, I'm not exactly sure how the process works to study to become a doctor, but
Sure.
is your residency your last step before you get your job?
So to gain entry into our U.S. system is different than the European system and that kind of thing. A lot of them will start to segue off as they get into their upper high school years and track towards their career. But in the United States, you earn an undergraduate degree, and medical school doesn't dictate what that degree has to be. Okay. Medical schools will have basic requirements. You have to have a certain number of math credits. You have to have, certain science credits. Biology basics, things like that you're going to need to continue your education. So in medical school, you may have people that were pre-med majors. You may have biology majors. You may have chemistry majors. You may have history majors and English majors. As long as they had those basic credits that were required to get into medical school, and they did well on their entrance exams, then they can get in. Medical school training currently is 4 years, and you spend several of your years in classroom teaching and didactics. And then you also begin to incorporate the clinical experience and the patient experience. And by the time you're, in your third and fourth year, you're on the hospital wards and the rounds and doing learning as you go. When you graduate medical school, you actually are a doctor. But most states won't give you a license to practice without the residency, or it's a provisional license. You can get a general license, but most insurance companies really want people who are either board eligible or board certified, which means that you go on to complete after medical school residency training, and that's in your chosen area. So I chose OBGYN. Somebody might choose pediatrics, somebody might choose anesthesia, somebody might choose general surgery or internal medicine or that kind of thing. And those programs and those training requirements vary. So some programs are only 3-year programs. Some of them are 5 to 7.
So after your residency, did you start work?
Let's see. After my residency, yes. After my residency, I interviewed with different practice situations, and I joined a small private practice.
So was like a private practice what most of the people who were in your residency did, or was there like another path that a lot of people chose?
So in OBGYN, for example, it's a 4-year post-medical school training, but there are what we call subspecialties. So within OBGYN, if you wanted, you could do additional training and become an oncology specialist in gynecology, a GYN oncologist. So they treat cervical cancer, ovarian cancer, uterine cancer. You could become an obstetrical specialist called a maternal fetal medicine doctor, and they evaluate and help to manage any fetal anomalies in a baby that's developing while the mother's pregnant, or any complications related to the pregnancy. So as an obstetrician, when I take care of mothers who have very risky pregnancies, I work with an MFM specialist who helps me to manage their pregnancy and get them through safely. There's also an area called urogynecology and one called reproductive endocrinology that helps people if they're dealing with infertility issues. So you can go on and do additional subspecialization, or you can stay general OBGYN. So some people will choose to apply for additional training and subspecialize and narrow it down as to what they're going to do and become very focused in the specialized area. I decided to go out and practice general. At the time that I was coming out in OBGYN, private practices were the norm. That is not the norm now. Probably 50 to 60% of physicians in OBGYN, maybe 60 to 70 after the recent pandemic, that was very difficult for many practices, are in what we call employed situations. So they may work for a company that manages OBGYNs and practices. They may work for a hospital system or another healthcare system. There's some larger healthcare systems. And there are still private practices, just not as many of them.
Mm-hmm. So in that first like private practice job that you took, was that the same? Like how long did you stay in that job?
Oh, let's see. I joined a group of 4 gentlemen, so I was the only woman in the practice, and that had positives and negatives. As the only woman in the practice, I had a lot of patients that wanted to see me if they wanted to see a woman, if they were more comfortable seeing a woman. So my practice grew very quickly, and I was very busy. But the gentlemen got to arguing over the finances of the business, as sometimes business owners do. And they decided after my second year in that practice that they didn't want to run that practice together anymore. So they folded it. And I had to choose whether I wanted to stay with 1 or 2 of them in a smaller practice or what I wanted to do. And I was very young in my career. I was only out for a couple of years. I didn't understand a lot of the business aspects of medicine the way I do now. And so I ended up switching jobs, and I went to work for a larger organization. I thought I will be safer there. There's not as much, up and down. And so I went to work for a larger organization, and I was with them for, I guess, 3 years or so. And due to changes in our family situation, by that time I was expectant with our second child, and my husband's job situation had changed, and we decided to move across the country. So we took a move across the country, and I went back into the private practice setting again.
So were those responsibilities in your first job similar to the one that you described in the beginning of this interview?
Yes, absolutely. That's what I was doing, seeing patients in the clinic, near the hospital, so that I could run over to the hospital and take care of a patient in labor if I needed to, and I might have scheduled surgeries. And we have after office hour responsibilities as well. We take what we call being on call, and that means if there's an emergency in the night, or if somebody goes into labor in the night, then we have to be available. And so as a group, you take turns, so you don't do it every night in a row. You take turns which doctor is going to be on call on which night. So yeah, right from the get-go.
So did you ever start your own practice?
I did. I left a larger private practice. Business and business ownership is tricky, and due to the way that business was being managed, at that juncture, I decided I was ready to try my own business, so that I wouldn't be a victim, if you will, of how somebody else was running their practice. I would call all the shots. I would make it perfect. I would fix all those things that I saw other people doing wrong, and I would make it perfect. And yeah. I think that was a lofty goal, but I did have my own practice and managed it very successfully for about a decade.
So how hard was that or easy to start your own practice?
Starting a business, no matter what industry you're doing, whether you're opening a restaurant, whether you're starting a cleaning business, whether you're starting a construction business, a design firm, a law firm, you name it, starting a business is one of the most stressful undertakings a person could choose. And so it's not for the faint of heart. There's financial risk involved, and there's tremendous responsibility that goes 24/7. Because if anything is going wrong in the business and you're the owner, you're in charge. You need to answer for it. There's not somebody else whose responsibility is, oh, so-and-so will fix it. No, that's you. And so with a medical practice, I was in charge now, not only of the patient care and everything we talked about before, but now I was in charge of insurance billing, paying employees who worked in the practice, securing supplies, having computer systems that work, phone systems that work, bank accounts, you name every aspect. Because a lot of things we just don't think about, right? You walk into the store, you go to Starbucks to order something. You don't think about all of the aspects of the business that are going on there, but somebody's in charge of that. And when you run your own business and you start, you're in charge of all of it. Your website, your marketing, everything. That was some sweat equity there. Now, on the flip side, if you take that chance and you're ready, and you're ready to put that sweat equity in, I would also say there can be tremendous reward in running your own business and creating a successful business. My brother launched a business about a year ago, and he was very nervous, and he called me about it and wanted some of my advice. But he talked about being very nervous that it wouldn't be successful. And we talked through what he was worried about and this, that, and the other thing. And I told him at the time, I said, you're going to do, and he had listed out, okay, if I do this much, we can pay the bills. If I do this much, We're going to be a little bit better than break even. If we do this much, I actually get to get paid too. That's the other thing about owning a business is you have to pay all the bills and all the employees before you get a paycheck. You're the last one to get paid. So if there's no money left, you get nothing. And if there's money owed, then you got to come out of pocket to cover those expenses. But I told him, I said, you will be successful. I said, you will be successful because you've thought it out very carefully. You have a good business plan and you're afraid of failure. You won't let it fail because you're going to do everything it takes to make it succeed.
Did you like owning your own practice more than working at someone else's?
It's 10 o'clock.
Oh, sorry. That was my computer.
That's okay. And that's the tone. The time will be. There are some very proud moments. I'm very proud of the business I built. I'm very proud of the service and the care given to patients, the respect that patients had, and the fact that people looked at our practice and it had a strong reputation for kind care, good care, and a good place to go. And so I'm very proud of that. And I'm very proud that it was successful. And that was, at the time that I decided to open the practice, there were a lot of people who didn't think I could do it and didn't think I would make it. And some of that is because I'm a woman. Although now there are way more women in OBGYN residency. In private practice, I think there are still more men in the field, although it's very quickly flipping, and there will be more women in the field probably over the next decade. But at the time, it's heavy male dominated, and there were a lot of people who thought I'd fail. And so there was a great sense of pride in the success. But owning your own business and being responsible for every final stop is stressful. Yeah. And medicine is changing. The business of medicine is changing, and that's unfortunate. Right now in the United States, we're in a system where private insurance, for-profit companies negotiate on rates and payments, both on the patient side, how much they'll pay if you need to go and get a tooth extracted, say. And on the provider side, on the doctor side, how much they're willing to pay the doctor. And those are controlled by for-profit companies. And so their goal is to, number one, have a good company that provides good market for their patients, but really their goal is to be profitable. And so the way they're profitable is by getting as much money from the patients as they can and not paying the doctors, or paying the doctors as little as they can, because what's in the middle is the profit for the company. And that is driving medicine in a very difficult direction in this country right now. And so that became a very difficult thing for me. I found as I was in managing the practice and the doctor in the practice, that as the years went on, I was spending more and more time on the business, the insurance contracts, the payments, and all of that stuff, and less time on the patient care. Mm-hmm. And the situation was getting worse and worse. So no matter how many hours I spent on it, till midnight, till 1 a.m, up at 6 a.m, whatever, trying to work the financials of the business, it was not becoming as profitable. It was becoming less profitable. And so it became very difficult because you had to see patients to make revenue, but you also had to spend all that time on the business. And that began to take away from my joy in owning the business. And that has turned me in a different direction now with my career. And so I did end up selling my practice and my business. And I am joining what we call a startup group practice. And it gives me, it's not a true healthcare company per se. It is a practice situation. But in this case, I'm going to have more partners. I'm going to have more business people in it. And I think with more people to help run the business, I think that relieves me of some of that pressure that was solely mine when I was the owner of the business and there was nobody else in it with me.
So, in your industry as a whole, are there things that you wish could be different or that you dislike about it?
We started to touch on it. I think that's evident in what I said in my bias, that I believe that insurance companies and health insurance plans, by nature, as a for-profit industry, has a conflict of interest with medicine, which is to heal and to help people and to do no harm. And how do you marry those two ideas? And our country right now obviously is struggling politically with, is healthcare a privilege or is healthcare a basic human right? And I don't know that I certainly don't have the answers to those questions. Those are very deep philosophical, societal questions to answer. But I think that right now, medicine is in a state of turmoil. And I believe right now that in our current state, patients lose out on their options for care and their coverage for care and their access for care when an insurance company either says, we won't cover that procedure, or, you know, they have what's called a deductible, which means the patient's going to pay a certain amount before the insurance does. And deductibles now are $1,000 to $2,000. So if I'm going to deliver a patient's baby and their insurance company says, well, you have to pay $2,000 first, that may be financially difficult for the patient. You know, but what's really ridiculous is that the doctor a lot of times is not even getting paid half of what the insurance company is charging on the patient side. So doctors and patients are losing in the current system.
So, what do you think is going to happen with your industry in the next 5 to 10 years?
That is a great question. That is a great question. So first of all, let me say this. If your calling is in medicine, if you're one of those people and your calling is in medicine to heal, there's nothing that takes that joy away. There are other parts of the world where, although doctors are respected, they are some of the lowest wage earners in different parts of the world. And I have a colleague who came to the States from South America, and he explained to me that in his home country, when he told his parents he wanted to be a doctor, his mother cried because she knew that financially he would be essentially in a state of poverty because of the way medicine works in their country. And she wanted him to have a better quality of life. So I think there are a lot of decisions that have to be made. So one, I think if you're called to medicine and it's what you love, there's nobody that can take away that love and that passion for you. And there's something to be said for really enjoying the kind of work that you do, whatever it is, because you're going to spend more hours working than you'll probably spend with the person you choose to partner with for life. And so you ought to pick something you enjoy. So I don't want to take that away. I don't know which direction medicine is going to go. I think at this juncture in my career, if I had the opportunity to get involved in the politics, I would want to, because I would want to help shape that policy and the direction that it goes. But in the United States has to decide if healthcare is a right or a privilege, because everything else that will change in medicine is going to be hinged on that decision. As far as other things in medicine, well, I think we're going to see really neat things come out of the scientific side and the research side. So obviously we all hope for success for those folks who are researching treatments for cancer. We hope for success for those folks who are researching genetic therapy for genetic errors, that people are born with genetic conditions and things like that. There's always innovations in surgical techniques to be able to do things in a less invasive way and a less disruptive way for treating patients. And those things will continue to evolve and expand. And those are exciting.
So, what kind of money on average do gynecologists or OBGYNs make?
Well, I can only speak to the United States. And it varies a lot. It depends on the part of the country you live in. Again, remember what I said about those insurance companies. The contracts and the insurance company contracts vary from different parts of the country. I would say probably if I think about what some of the latest published averages are, probably in the high 200s for somebody who's truly working full time. And I always want to caveat that sounds like a lot of money. And it is a lot of money. But it's not a lot of money working 9 to 5, 5 days a week. It's a lot of money working 24 hours a day, 7 days a week, 365 days a year. And you hope that you have good partners to share in the call coverage, to cover on a holiday, to cover on a weekend, to cover on somebody on an anniversary or day that's special for you so you can have a day off. So to achieve that level of salary, you're working way beyond what most people consider full-time. And I think sometimes there are lots of industries and lots of other professions that people work longer hours. And they work hard on those 60, 80, 100-hour weeks, extra hours. But OBGYN in particular, I would say obstetrics and trauma surgeons really are called at all hours of the day and the night. And that is very physically tasking and challenging, that is particular to some of those areas that sometimes for some people don't make that huge amount of money seem worthwhile.
So, kind of touching on what you just said, in your experience, how is like the balance between work and life? Do you have a lot of time for other things outside of work?
I think everybody finds their balance. And I've had to learn it along the way. And that's something actually that a lot of women physicians will talk to each other about, because traditionally, and it's not every household, but traditionally women tend to be the caretakers for families, and women bear the children. That's just something physically that we do. And so women, whether they're teachers or whether they're nurses or whether they're lawyers, whatever they do, a lot of women balance a heavier family responsibility load and workload as compared to traditional male roles. And so a lot of us talk about, how do we balance it? How do we take care of our kids and get the groceries and run a load of laundry and make sure that so-and-so is to rehearsal on time or practice on time or things like that. And so it was definitely a work in progress to figure out how to balance that. And there were times in my career where the balance was not there and the workload was disruptive to my family. The divorce rate in medicine is high, and that is very unfortunate. It's very demanding on families. I am very blessed to have a wonderful husband and partner and an understanding family. And I've learned that you've really got to pull together with your colleagues. You've got to help a colleague out when they need time off, and the colleague has to help you out to cover. And so you come together. You come together as doctors and as a group to be able to cover each other so that there is good patient care and the patients are covered, but so that doctors can be people too.
So for high school students who think that they now want to become an OBGYN.
I hope I didn't scare them all out of it.
What advice would you give them? Or like, maybe if it helps, what were you like in high school?
No. I was a nerd. It is true. I've changed a lot. I have and I haven't. So the laugh is still there. My friends who have known me for years and years and years and are still my dear friends, they hear the laugh and they start laughing because they know the laugh. So that hasn't changed at all. And they're very kind to me. And on my recent birthday, they all said you look exactly the same, which I think they were lying, but that was very sweet. Um, um, I did always have a strong work ethic. I did always want to do my very best for success. And I think you need that for medicine. I mean, I think you need that for any career, but particularly to succeed through the trials, both the academic rigor that you go through to become a physician, as well as the physical rigor, that you need that drive. That has to come from the person themselves. That can't come from mom and dad yelling at you to go study or get your grades up. You've got to be the one who wants it. It's no different than in a sport. If you're an athlete and you have an opportunity to play at a certain level, the coach yelling at you or cheering for you as loud as they can doesn't make a difference if you don't want it for yourself. So it's got to come from the person. And I think that drive to be the best person you can be, that's probably where it starts.
Okay, well, that was my last question. So thank you.
You are so welcome. These are wonderful questions. And I do still think medicine is great, but in general, I love math and science. That hasn't changed. And I love those areas. And if I were to leave people with a parting thought, it would be the same way we started, which is what's changed from high school to now is in high school, I didn't understand the variety of career options that would open up no matter what I chose. I'm very happy that I ended up in medicine. I think it was my calling. I think it's what I was meant to do. And I think I ended up in the right place. But I think as other people start to figure out their journey and where they want to go, they should understand that just because you begin to go in one direction, it doesn't mean you're stuck there. There's a lot that'll open up for you in your future.
Well, thank you.
You are very welcome. And thank you for giving me the opportunity. Those were fantastic questions.